Understanding tendinitis.
Hi, I'm Dr. Hayes Hernandez here at Orange County Physical Therapy in Newport Beach, and today I'm going to talk to you a little bit about tendinitis and hopefully give you a better understanding of what it is, what causes it, some very common types of tendinitises, the symptoms associated with tendinitis, and also what you can do for tendinitis if you suspect that you may have it. First, let's talk about the word itself, tendinitis. It gets thrown around a lot, but I think it's important that we understand exactly what it is. First, what's the tendon? Tendon is a tissue in our body that connects our muscles to our bones. It's a very important junction between those two things that facilitates us moving. We need tendons in order to generate the force from our muscles to our bones and give us meaningful movements of our joints. So very important. Second, what's the suffix itis means? It's a term that just means inflammation, plain and simple. So when you say tendinitis, it just means inflammation of a tendon. Itis after any body part can mean or does mean inflammation of that body part. So next, I'm going to take you through a couple slides just talking about some of the common ones, some of the common causes for it, some symptoms, and what you can do to hopefully improve and get rid of your tendinitis.
So, what are the most common types of tendinitises? These are the most common tendinitises we see in the clinic, and also the most common ones you're most likely to experience. Rotator cuff tendinitis is a tendinitis of the tendons of the shoulder. The rotator cuff are four muscles that work together as a group to support the shoulder. Patellar tendinitis is inflammation of the patellar tendon at the knee, usually associated with running and jumping. Peroneal tendinitis is tendinitis of the peroneals or muscles on the outside of the lower leg, usually associated with deviations in the way we walk, running, or even intrinsic foot weakness. Then here, the next two are very common: tennis elbow, golfer's elbow. Most people have heard of them. These are actually tendinitises of the elbow, one being on the outside of the elbow and the other on the inside of the elbow. And then lastly, Achilles tendinitis, which is an inflammation of the tendon in the back of the ankle, usually associated with running and jumping as well. So, what are the symptoms of tendinitis? Below are three of the hallmark symptoms and the most common ones that may indicate that you're experiencing a tendinitis. The pain level usually ranges from a dull ache to a sharp pain and can be pretty high in the acute state. So once it starts, it could be 6 out of 10 or higher. It's usually pain that's associated with movement of the joint. So say it's a tendinitis near the elbow, flexing or extending your elbow will elicit the pain. And then lastly, usually in the acute setting as well, you're going to see some mild swelling around the tendon, some warmth, maybe even some redness around where that tendon is. That is letting you know that there is an inflammatory process happening at that tendon. So we know the symptoms now. What are the common causes for tendinitis? So the most common causes are below. Repetitive movement. So say you're a painter, you're constantly doing overhead painting, you're at a higher risk for developing a tendinitis of, say, the shoulder. Overuse. This is a little bit different than repetitive movement. This is more so you're doing a motion repeatedly and you're not allowing yourself time to recover. So in an otherwise recovered state, that tendon would be healthy, but you're not allowing that recovery to happen. So that's overuse, and that can also develop into a tendinitis. Next, and this one we're seeing a lot of this year, 2020, because of the pandemic, but also you see it at the beginning of the year when people are rededicating themselves to getting back to exercise. So it's relative inactivity followed by beginning a new activity too quickly. So it's very common to develop tendinitises when we basically go from couch to very active too quickly, and we don't allow ourselves a graded process and time to recover. And then lastly, poor movement patterns. So if we're not moving the way we're supposed to, if there's muscular imbalances or flexibility deficits, many other types of movement pattern deficits that could be going on that can also make us more susceptible to developing a tendinitis in our bodies. If you suspect you may have a tendinitis, what do you do? First and foremost, rest. Uh, Make sure you're getting plenty of sleep, you're staying hydrated. Tendinitises are usually a product of overuse and not allowing yourself to recover enough. So, rest is very important. Avoid the aggravating activity. If it hurts every time you hit a tennis racket, don't hit a tennis racket. Next, in that acute phase, the first 48 to 72 hours, icing can be very helpful at quelling the inflammation and also lowering the pain. If the pain is extremely debilitating and you can't function due to it, an over the counter anti inflammatory isn't always out of the question. Just consult your physician or pharmacist before you start taking a lot of over the counter anti inflammatories. And then, lastly, and the most important, is contact your physical therapist. They're going to be able to get you moving quicker and recovering quicker. Once in physical therapy, you'll be able to work through a series of treatment protocols that will help you recover from tendinitis quicker than if you try to do it on your own. So, some things your physical therapist is going to help you with is some pain relief techniques. They're going to use comprehensive manual treatment techniques, including massage, soft tissue mobilizations with instrument, cupping, manual stretching, just to name a few. Importantly, they're going to also get you to start loading the involved tendon appropriately and graded, right? It's not going to be something that you're just all or nothing principle. It's going to be a progressive loading of that tendon and then progressing you to fully loading of that tendon, getting full recovery, and also getting you to a place of prevention and making sure that you don't develop any sort of movement patterns or any flexibility deficits that may put you more at risk of getting tendinitis of that area again in the future. So preventative care is going to be a big part of your physical therapy protocol.
So hopefully this video has been very informative and helped you understand more what tendinitis is, how you get it, and how it's treated. So if you suspect that you might have tendinitis, or your doctor has told you that you have tendinitis and referred you to physical therapy, don't hesitate to give us a call. Our number and our website is in our description below the video, so check that out. We're looking forward to hearing from you and answering any questions that you may have about tendinitis, as well as any other itis that you may be experiencing. Again, have a great day from Orange County Physical Therapy. I'm Dr. Hayes Hernandez, and I look forward to hearing from you soon.